barely opened my mouth and had lost 10 pounds in 2 weeks. So my husband took me to see the oral surgeon, who took one look at my imaging and asked, again, "Are you sure you've never been in an accident?" I said, "What do you mean, and why do you keep asking me that?" Pointing to my imaging, the surgeon explained that there was so much scar tissue and joint degeneration that I must have experienced some major trauma to my jaw in the past. Suddenly, a memory of my 19-year-old self came flooding back. It was a trauma I'd buried subconsciously for over a decade. I was riding in the car with my easily distracted, slightly spacey friend when she accidentally drove her car off the road. So I got out to help push, just like anyone would do on the country roads of West Virginia. But while I was behind the car, my friend got the bright idea to reach inside and shift into neutral. We were on an incline, so the car flew backwards, throwing me over a huge hill and landed perpendicular with me underneath it. I blacked out. When I opened my eyes, my friend was kneeling beside me, praying that she hadn't killed me. I made a little suggestion that maybe she could pray on her way to go get help. The ambulance arrived and whisked me off to the ER, but the doctor wasn't George Clooney or McDreamy, so I really just wanted to get out of there. My whole body ached, but all he saw was a little burn on my ankle from the muffler, so he said I was probably okay. Turning back to the oral surgeon, I blurted out, "Yes, there was that time my friend ran over me with her car." What the ER doctor and I failed to recognize that day was that I had hit my head so hard, the impact had caused bleeding and cartilage damage inside my jaw joints, and lack of early intervention led to a lifetime of pain and dysfunction that literally changed my life. The TMJ, or temporomandibular joint, is the only joint in the body you need to live. Put your hands on your face and feel it. You use it to eat, to talk, to smile, to kiss, and to breathe. When something goes wrong with it, the whole person suffers. And the public health impact of these conditions is huge. According to the National Institute of Dental and Craniofacial Research, these conditions affect 35 million people in the US, the majority being women, by the way, with an estimated annual cost of $4 billion. Here's another surprising fact. Most dentists were never taught how to manage this joint, and it's the only one in the body that isn't treated by an orthopedist. This disjointed approach leads to a troubling reality for TMJ patients, because until last year, the NIH was only spending 50 cents per patient per year researching the must-have joint. And 85% of these patients also suffer from multiple coexisting conditions that affect the rest of the body, lead to a perpetual cycle of referrals and consultations. They may visit a neurologist for headaches, an ENT for ear pain, a GI doctor when digestion is affected by an inability to chew food properly, and a behavioral health provider for the anxiety and depression that go hand in hand with chronic pain. Each of these specialists may not even hear about the TMJ complaint because Isn't that for the dentist? But think about this. Natural law didn't divide us into three parts: medical, dental, and behavioral health. Society did this for the purpose of healthcare delivery. But each professional group isn't sufficiently informed about the others to make total integrated care a reality. We need to start breaking down the silos that separate medical, dental, and psychological care. Things might change one day, but not fast enough. So we need to do it for ourselves. 5 surgeries later, this is what my jaw looks like now. I'm bionic. I was propelled into the world of TMJ by that fluke accident, first as a patient, who then became a dentist and married one, and has immersed myself in learning, lecturing about, and leading integration efforts for patients like myself. So, why did it take me so long to make that mouth-mind-body connection? Maybe I didn't want to take up a 15-minute doctor's appointment talking about something that seemed irrelevant. Or maybe I thought being stressed, depressed, and exhausted was just part of the college experience. Do you remember that little song we learned in preschool? Head, shoulders, knees, and toes, 2 different doctors, they all goes. Don't worry, I'll keep my day job. But the problem with this approach is that when we look at every part of the body in a different exam room, we're failing to see the whole person and putting them through prolonged suffering. Specialization and scope of practice not only dictate the course of treatment, but even the diagnostic process. I do research at a medical school where recently I saw a man who had been referred to a neurosurgeon and was seriously contemplating brain surgery. He was in so much pain, he was rapidly losing weight and slowly giving up on life. And because he described bouts of sharp, stabbing pain in his face, he'd been told that he had trigeminal neuralgia, a rare condition that's often nicknamed the suicide disease. I asked him to open his mouth and discovered that his severe facial pain was coming from an ill-fitting denture. The referring physician saw the gentleman pointing to his face, but wasn't thinking about what was on the other side, just a few inches below his brain, his mouth. And this is why we need medical, dental, and behavioral health care integration. We have to use biological, psychological, and social principles to address overall health and well-being. But while the evidence is strong for this biopsychosocial model, progress has been slow due to a myriad of systemic and institutional obstacles, which is really a polite way of saying deep pockets and egos. Removing barriers to healthcare is essential for patients and providers to form partnerships that become the true cornerstone for coordinated care to materialize. We're all too familiar with barriers to healthcare, like long wait times or clinic hours that aren't convenient. But what improves our experience is much about interpersonal aspects, like finding a doctor you like, someone you feel comfortable sharing with, and who takes your concerns seriously. Research supports the idea that facilitating healthcare also involves a sense of agency. This isn't just a desire to take charge of your health, but also feeling capable to do so. And when people are in constant pain, They cannot do this alone. When my husband heard that story about the crazy accident, it was the first time he'd heard about it, which is weird because he'd heard about all my other way less interesting stories. He was the one who began connecting the dots in my overall health picture. He watched me struggle with eating and sleeping. He helped me remember what to tell my providers. He listened to my worries about the impact that my chronic pain condition would have on our growing family and gently wiped away my tears. His mantra as a dentist has always been, people don't care how much you know until they know how much you care. Every chronic pain patient needs someone like him, whether it's a family member or your family doctor, because the missing piece in healthcare is often care. Now, I'm not saying that doctors, dentists, and affiliated providers don't care about their patients. Most of us go into these professions because we want to be healers. We want to promote a culture of health and well-being in our communities. But it's not until we get out there in a system that has shifted the focus to efficiency rather than empathy, technology rather than teamwork, and policies rather than people, that things become incohesive. Imagine if we all woke up tomorrow to find that all the barriers to integrated care had been dismantled. But let's be realistic. We're still waiting for hospital gowns that cover more than in our insurance plans. Here's what I'd like to leave you with. I'd like each of you to think of yourself as a partner in your own healthcare journey. Patients, seek out those providers who really see you, the ones who actually listen to understand you. Use your voice to advocate for yourself or bring a loved one with you to your appointments for support. Don't ever let anyone tell you it's all in your head. And make sure that any proposed treatment follows current best evidence before saying yes. And healthcare providers, remember that all people deserve care that is safe and emblematic of the oath to do no harm. Look at the whole person and not just a single complaint. Respond with empathy and a warm, sympathetic tone. And remember that each individual is a unique person with an interrelated set of factors that can either perpetuate or protect them from an illness. By doing this together, we can bring care back to healthcare and the head back to the body.